Hello everyone, welcome to Inconvenient Truths. I'm your host, Jennifer Zeng. Where Chinese-made vaccines cause widespread public health emergencies, the sudden death of Hong Kong actress Kathy Chow, who once promoted vaccines for the CCP, has raised this question. In fact, many Chinese cities have already conducted large-scale emergency drills for vaccine safety incidents. Today, let's discuss this issue. In our previous episode, we discussed the sudden death of renowned actress Kathy Chow and her previous involvement in promoting Chinese vaccines. Now, more information has emerged. First, an electronic medical record of Kathy Chow was leaked online. In theory, a patient's medical record is private, and I didn't originally plan to reveal it on the show. However, something happened today that made me change my mind. And this event is that the CCP officially announced that the police have arrested a 36-year-old man named Fu for taking a photo of Kathy Chow's medical record and sharing it on a WeChat group. There were also official reports yesterday that a hospital employee had been suspended for this. Today's online news says that the employee has been fired. Online sources also said that the arrested man was not a hospital staff member as claimed by the authorities, and that he got the medical record from his girlfriend, who is a nurse at the hospital. So the fired employee must be his girlfriend. From the leak of the medical record to the arrest of the responsible person, it only took 2 days. The CCP certainly acted quickly. Of course, as a hospital employee, it is indeed very inappropriate, even unethical, to release a patient's medical record. However, if this medical record involves the health and the safety of more people, of the public, perhaps it should be treated differently. Why could Kathy Chow's medical record possibly involve public health and safety? I'll discuss this issue later. Let me first talk about the different ways the CCP has handled similar incidents of leaking patients' medical records. What you see now is a book written by former China Central TV CCTV host Cui Yongyuan, whose fame is equal or even greater than Kathy Chow's. The cover features a photo of him. A few years ago, Cui was taken to the hospital by an ambulance for emergency treatment, and his medical record was also leaked, but no one was held accountable. This shows that the CCP does not consider the leak of a celebrity's medical record to be a serious matter. According to Professor Luo Xiang from China University of Political Science and Law, doctors and nurses who leak patients' medical records are in violation of China's physician law and should be warned or suspended from practice. If the patient's relatives feel that they have suffered mental harm due to the leak, they can request compensation for mental damages from the court. He also said that although China's criminal law stipulates that the infringement of citizens' personal information can result in a maximum sentence of 7 years in prison, the dead are not considered citizens. So the violation of a deceased person's information is generally not considered an infringement of citizens' personal information. So in the current situation, since Kathy Chow was unmarried, had no children, and there have been no reports of relatives seeking compensation for mental harm, why did the CCP quickly solve the case and make an arrest in just 2 days? Let's answer this question a little later. Now, Let's take a look at her medical record again. It says that Kathy Chow was living alone and had symptoms such as coughing, shortness of breath, and difficulty breathing in the past week. She was using an oxygen tank at home. On December 10th, her condition worsened, and on the morning of the 11th, her colleague found her unconscious on the floor. She was rushed to the hospital, where doctors found her unresponsive with a rigid body and cold skin. Her pupils were dilated and unresponsive to light. Conjunctival hemorrhage was present with 8 mm bleeding spots, and no heartbeats or breathing was detectable. This means that she was already dead on arrival. It is possible that she had already passed away at home. The medical record also mentions that she had a history of hypertension and systemic lupus erythematosus, SLE. Chinese YouTuber Tang Jingyuan, who had a medical background, has analyzed her symptoms and concluded that her condition may not have been severe, as she did not seek medical attention for a week, and her sudden deterioration and death at home suggest that she may have died from COVID. The most prevalent Omicron subvariant XBB.1.16 is known for its strong transmissibility. Medical reports from India indicate that this variant can cause eye infections and bleeding under the conjunctiva. Tang Jinyuan believes that although Kathy Chow's medical record does not mention a COVID test report, a combination of signs and symptoms suggests that she died from a COVID infection, probably caused by the XBB.1.16 variant. Additionally, there's data showing that she received 4 doses of vaccines during her lifetime. On April 18th, May 14th, and December 11th, 2021, she was vaccinated with viral cell inactivated vaccines produced by Sinopharm. And on December 22nd, 2022, she also received a nasal spray vaccine, which was produced by Beijing Wantai Biopharm. This was posted by her studio. Tang Jinyuan mentioned that although Kathy Chow had SLE, an autoimmune disease, that is not fatal under proper medical care. However, given her condition, she might have imposed a greater potential risk on herself by serving as a vaccine promotion ambassador for the CCP and receiving 4 doses of Chinese-made vaccines. Now, let's talk about why Kathy Chow's medical record might involve public health and safety. First, judging from the CCP police response, I think they are very eager to cover up how she died and even more reluctant to let people associate her death with the fact that she had received 4 doses of vaccine and served as a vaccine promotion ambassador. Secondly, let's take a look at this photo. The Chinese characters on this large sign read 2023 Vaccine Safety Emergency Incident Response Exercise Activity Site. This sign was photographed at the gate of a police station in Xi'an City, Shanxi Province. If you search for vaccine safety emergency incident response exercise online, you will find many results showing that many cities have conducted such exercises. This screenshot shows that such exercises have been carried out in Hubei, Guangzhou, Wenzhou, and Linchuan County, Sichuan, Shanxi Province, etc.
16日，由四川省药监局指导、成都市市场监管局主办的承德梅兹疫苗质量安全突发事件应急演练在成都举行。
This video is our official report showing that on November 17th, Chengdu City held a vaccine safety emergency incident response exercises. The content of these drills includes the preliminary handling of vaccine safety incidents, information reporting, security alerts, medical rescue, comforting family members, news releases, follow-up measures, etc. In total, there are 14 items in the drill. So, this emergency drill is a unified arrangement by the CCP authorities from top to bottom, and it is conducted in all regions of the country. In my understanding of China, the fact that the authorities need to conduct such large-scale exercises can only mean that vaccine quality and safety incidents have become very serious and widespread. Otherwise, they would not have conducted such exercises. These are more photos of such drills. Do you remember that on September 18th, 2019, 30 days before the opening of the Wuhan Military World Games, the Wuhan Customs also held an emergency response exercise for sudden incidents. The exercise involved a foreign traveler feeling unwell and being rushed to the hospital, where the diagnosis was a new coronavirus infection. This is my translation of the official report. Then, shortly after the exercise, an outbreak really occurred, and it was precisely a new coronavirus infection. Then it came the pandemic that affected the entire world. Do you think this is a coincidence? Now, let me share a TV report.
生发烧请假，还有很多老年人去世，火葬场爆满，甚至有的人出现了随地倒的猝死现象。
Chinese entity TV reported that according to a television interview with a citizen in Chongqing City, the phenomena of sudden death have reappeared in the city. In addition to the fact that many students have a high fever and take leave, many elderly people have passed away and the crematorium has become overcrowded again. The citizen said that on December 11th, while he was taking a bus, a young woman in her 30s suddenly collapsed and died, but the information was suppressed, and there was no official report about this. If a famous actress with access to good medical care can die suddenly at home, it is not inconceivable that a member of the general public can suddenly die on a bus. These are the screenshots of other netizens complaining about suffering of the decisions. And these are the videos still showing overcrowded hospitals in China.
重庆市民王先生表示，去年12月防疫放开后，
So there are more footages of Chinese hospitals from Chinese entity TV.
跟新冠那个时候感觉一样，就是没有味觉，吃什么东西没有滋味，闻什么味也闻不出来，没打疫苗，没怎么吃药，然后2天就过去了。
新滩记者熊斌、黄宇宁采访报道。
China CDC stated that currently the XBB variant is the main local epidemic strain in China, with a strong immune escape ability, and it is prone to breakthrough infections. Experts warned that a new wave of epidemic peaks may occur in China around New Year's Day. However, from the current situation, it seems that this wave of epidemic has not yet spread globally. If the situation in China is mainly related to vaccines or some specific factors of the CCP, perhaps the people in other regions do not have to worry so much. Of course, as the situation is constantly changing, we should still pay close attention to the news coming from China. Well, that's all for today. If you find my content valuable, please support me by sharing my content and channels. You might also want to visit my website, jenniferzengblog.com, to sign up for a membership or make a donation. I regularly post the scripts of my shows in the members-only area on my website. This is for those who prefer to save time by reading the script instead of watching the video. You can visit my website to enjoy this service. Thank you. See you next time.